Hello. Hello.
Hi, welcome. Okay, we're live now. All right, welcome back to House Human Services. This afternoon, we're going to spend a little bit of time. We have a brief amount of time, really, with the Director of Office of Economic Opportunity and the Deputy Commissioner for Economic Services, Miranda Gray, and Lily Sojourner. And I see that you actually did send a presentation. Is that a presentation?
Yeah.
Or is that from before? No, 2025, that's now. We did, just so as an FYI for background for people, I did send them the presentation that you did last year, so that people would have some background and an opportunity to review it before you got here, so they can kind of maybe hopefully have more concise questions as we look through this. So I think that, and a lot of this looks, very similar to what we saw last year. So I guess I would say, why don't you briefly go through the presentation? I don't think we need to spend, we've taken a lot of testimony in this committee. So I think I'm not going to say we're experts, but we're pretty familiar with sort of, a lot of the elements, maybe not exactly about how they all fit together. So that's the piece that I think we probably could use some assistance in understanding. So I turn it over to the two of you.
All right. Thank you so much. For the record, Miranda Gray, the Deputy Commissioner of the Economic Services Division, and did want to thank you for the flexibility to attend via Zoom. We know that is not normal for us. We do have to be at a meeting in person for 2, so we just need to jump out, about 5 minutes early, and appreciate that flexibility. Also want to start by thanking you all for your continued dedication to addressing homelessness in Vermont. And I also wanted to acknowledge all of the testimony that you have been receiving. I know that we haven't necessarily been in the room, but I wanted to assure for both the committee and anybody else that is watching that we are tracking everything, and truly appreciate all the efforts and all of the information that has been shared here in this room, and some of it new and much of it not. But I think it's just been important to be able to hear the full spectrum of what people have going on. And I apologize, I know I have like a background going on. I'm not going to fool around with it in Zoom because I don't really know how to that well. I also thought it would be helpful as kind of setting the stage of before Lily got into her presentation, is just kind of where the administration stand, in terms of starting for July 1st, 2025, but also acknowledging that we are in agreement that we need a longer term plan, and then that we're going to probably need a runway in order to be able to have things in place into the future. So, as you know, in the governor's recommended budget, we have asked to be able to keep the same rules that we have in place right now through Act 131. However, with a few changes, and those changes include expanding family and medical vulnerable shelters, changing the extreme cold weather conditions to -10 to -20. So that's something we continue to explore, and involving municipalities in the creation and decision making with state funding and logistical support. So we've made a concerted effort to be engaging more in many aspects of both running shelters, but also how are the motels impacting communities, etc. And so we will continue to do that. In terms of some of our goals for our long-term program, we know that we need to create more permanent housing. At its core, homelessness is a housing problem. I think we can all agree to that. I feel like that was a theme that you heard. We want to keep homelessness rare, brief, and non-reoccurring. We want to protect the most vulnerable and at-risk populations. We also know that we need to save lives during extreme weather. We want to meet people where they are and provide appropriate support regardless of the setting that they're in. We also want to improve service delivery in those connections, which I think is also a theme that you have been bringing up in the committee room. We want to reduce reliance on for-profit hotels and increase the use of nonprofit shelters. We also want to empower local communities to build the solutions that work best for them. So we'd like to continue to focus on increasing traditional shelter. Where we can, maybe the hotel and motel conversions into permanent units. We have seen this as a strategy that works in many areas, and so would like to be able to focus on that as well. We also know that we need to start targeting eligibility to assist people more thoroughly and effectively to keep them from returning to homelessness. So I know that maybe we're not yet in agreement on what that looks like, but I think we all know that we need to be able to do some more focused efforts there. And then lastly, we also know that we need to have emergency extreme cold weather shelter. The evolution of the GA program has blocked its ability to serve the most needy, and that has been seen here this winter of being cold weather not being expanded to others having to meet eligibility criteria. And so we are looking to create 6 weather-dependent congregate pop-up shelters across the state, looking at kind of what we call our 5 Ds and our R, the Bennington, Brattleboro, Central Vermont, Burlington, Breland, and then also something up the Northeast Kingdom. So wanting to do that. And as I mentioned, focusing on bringing those extreme cold weather conditions, changing that criteria there a little bit. So I will pause there, and then there's no questions, let Lily jump into more of the HOP related information.
Before we move to Lily, I just, so, you kind of caught us in the midst of a transition process of where, yes, we're still working on 91, but we're having to make our budget recommendations for 26, essentially kind of in this next 24 hours. And I just am looking at the response that you gave me to the question I asked last night, and I think you might have misunderstood the response. It didn't have anything to do with FY25. I was just looking for if you had, the governor has in his budget 38.6, 38.6. Is that the right number? See if 38.1 or 38.6, I can't remember. In GA, hotel, motel, shelter, whatever you want to call it. 8.1 and then 30.5. Yeah, so it is 38.6. That's what we can figure out from your budget documents. And I was just looking that if we were looking at capacity, how many rooms with $38.6 million purchase, essentially, let's just assume you had full occupancy for 12 months. How many rooms would that purchase? I mean, I did my own calculations based upon $85 a day, even though because that extra $5 accounts for the other expenses. And, came up with an amount, but I know that, your financial wizards there sometimes do something different, but, you should probably watch in if you're able, or watch back our, when we're done with, this segment, we're going to move back into budget discussions and we're moving into DCF. So that was, it didn't have anything to do with FY25, because we had actually been told when we put in our budget recommendations for BAA that in order to maintain 1,100 rooms under cold weather provisions, without the 80 days, it would only be another $50,000. We were told that way back when we were doing the BAA in here. And so that's the figure that we're still using when we're thinking about, what the trajectory of looking at the FY25 BAA is. And I know that I think that JFO or somebody is asking for further clarification about the 1.8 million, because I think there's some question about the accuracy of that information and wanting to have further clarification, but that's all happening outside of this meeting. So I just wanted to clarify that the response that you gave me was not the response. I was not looking for FY25. I'm looking for FY26. If you have X amount budgeted, and I was looking at 2 figures, so 38.6, which appears to be what's in the governor's budget, and then the 44 million, which is what we have right now, absent any BAA for FY25.
Thank you for that clarification. I imagine there are others that are watching right now and making sure that we are getting you what you have asked for.
Okay, all right, thank you.
You're welcome.
Okay, thank you, Lily, for being patient on that.
Yeah, thank you. Good afternoon, everyone. Lily Sojourner, the Director of the Office of Economic Opportunity within the Department for Children and Families. Yes, as you mentioned, Representative Wood, I updated some of the PowerPoint templates that we had last year. I can go through that fairly quickly unless people have questions about slides. And then I did some of the ones that had like state fiscal year data, I did update those. So I can start, happy to move through fairly quickly if it sounds like folks had that in advance. And then I would just encourage people to jump in if you have questions on a particular slide while I'm presenting, if that would be helpful for me to pause. So let me see if I can share my screen. Are folks seeing the presentation?
Yes.
Okay,
Yeah.
great. And I have two screens up, so if I'm not looking at you, here, let me see if I can move this. There we go. So thank you for the opportunity to talk through this. Again, happy to hear any questions folks may have. So again, this is just trying to talk about how this all works. So we have our state programs and resources. I've listed a few, but then there's also sort of a process and a structure that supports the work that we do. And I'll talk about that a little today. I wanted to just make sure folks had this for reference. It sort of summarizes different types of housing interventions so that when we use this language, we have sort of a shared definition of what we're looking for or what we're looking at. So from prevention, the emergency response, this rapid rehousing model, permanent supportive housing, that includes things like the new permanent supportive housing assistance Medicaid benefit, and then just generally affordable housing. And so these are various types of interventions that we utilize in the state. I think often people will hear this analogy of the three legs of the stool. So we're looking for a unit, the rental assistance, and supportive services. Not every household experiencing homelessness needs rental assistance or needs supportive services, but for a portion they do. And so these would be the three things. You want to make sure you have the unit, it's affordable for the household, and if they need services, they have access to those. I did want to reference Vermont's two HUD recognized continuums of care. There's Housing and Homeless Alliance of Vermont, which serves as like what's referred to as the balance of state, and then the Chittenden Homeless Alliance. They really provide this local planning and collaboration to kind of help identify gaps, help communities identify goals, identify what resources are needed, and create linkages among programs. I think we've gone through this slide before in an earlier presentation, but just again, referring to this definition of what are we talking about when we say homeless? There are definitions that we utilize from HUD, which is Housing and Urban Development. This is a good reference. Again, just wanted to kind of make sure people had the links to the 2024 data, both the Vermont as well as the national data. What we're seeing in Vermont is really mirroring trends that folks are seeing nationally in terms of increases. Unfortunately, a lot of people coming into homelessness for the first time. So again, just wanted to kind of update those numbers from the presentation last year. This is also updated from last year. These are shelters that we fund and some of the characteristics that we see. So again, you can see that a lot of these have increased in terms of we're seeing older adults, we're seeing slightly higher percentage of people who are then identifying mental health disorder, substance use disorder, or another disability. I can pause here a little bit on coordinated entry because I do think this is something that for folks who are new to the system can be important to make sure we understand. But coordinated entry is about ensuring that access to services is streamlined and that households experiencing homelessness are able to quickly access the assistance they need and for which they are eligible. This is a process mandated by HUD. We have two HUD jurisdictions in Vermont, again, Chittenden and the balance of state. And this is funded through the Office of Economic Opportunity and also by HUD directly. And each jurisdiction has their own coordinated entry committee that serves as a decision-making body. It's really a helpful reorientation of the system so that we are able to identify like what works best for a household, preventing kind of a multiple door approach. This is one assessment that a household can do. We have carefully designed protocols. We're able to create greater transparency for providers and clients about what's available. And I think that's then where often the frustration comes in right now, is that we often don't have something available. So I want to emphasize that coordinated entry is a process, but it's not in and of itself a resource that guarantees, for instance, a unit or services. I have this other slide, which at first can be overwhelming. And I think we provided a breakdown of this last year that I can walk through. But really what we're trying to do is connect folks in housing crisis to supports and resources. And so as you go through left to right, we're looking at access. And so these agencies and others, they're either going to conduct the coordinated entry assessment themselves, or they can refer to the coordinated entry lead area agency in their area. And I have that on the next slide. So it's multiple points of access, all funneling people to one assessment. Then in the assessment, that's going to triage any emergency needs and try to make those immediate connections, for instance, with the shelter, any local food or other basic needs resources in the community. But then they're doing a uniform assessment to collect demographics, identify any service needs, housing barriers and goals, housing history, and do some screening for eligibility. And once assessed, households are placed on the local community-wide master list. Then we get to sort of our problem solving. So looking at what benefits and services might a household need. Are there multiple folks involved with the household where care conferencing would be helpful to kind of ensure people are working together? Access to financial assistance could come into play at this point. Just really kind of looking through the resources that are available and helping make those connections. And then the goal, right, is that people get into housing. And so you have some, and sort of the top section is really just sort of housing resources that exist for everyone and that we might be helping people access. And then there are specific housing options that may only be available, and that could be unit, rental assistance, services, or a combination of those, really only for people experiencing homelessness. So this is just kind of wanted to walk through that because I know we get a lot of questions there. This is a list of those local coordinated entry lead agencies. And then I'm wrapping up, and I apologize for going so quickly, but again, it sounds like you've had some of this in advance. So I just wanted to make sure folks had the updated links for our award summaries where you can see what resources are available in the community. We have launched the new permanent supportive housing assistance program. We have a contract with Groundworks in the Brattleboro community and are in the process of finalizing a few other contracts, which is really exciting. So that's capacity for 100 participants. So happy to share that that is continuing to go forward. And then just a reminder of some of our one-time programs that we administer, and then also referencing that we are still administering the one-time emergency rental assistance housing stability services, which does end this June. So that was my quick overview. And again, some of those slides probably look familiar if you had a chance to look at what Sherwood shared, and happy to take any questions.
Thank you very much, Lily and Miranda. Appreciate that. So I have a couple of things to start off with, and it's kind of actually on the last slide that you shared. So we've heard from a lot of witnesses around ERAP and those supports ending, and we didn't see anything I'm going to say in particular, the supports. I know that everybody likes rental assistance and all of that. But we also have another program that's doing that, and some other general HOP grants can do it. But the thing that people have spoken most about are you can call them by whatever name that you want to call them. Some people call them service coordinators, case managers, housing navigators. They're all doing similar things. It's really the connecting and the wrapping around the individual, and then trying to connect them to not only housing, but to the other supportive services that they might need. And I don't see anything. I mean, I realize that we're seeing that is a critical service. And I've heard the administration talk a lot about, like, okay, well, that's the kind of service that you get if you're in a formal shelter, a formal community-based shelter. So I guess we do have some questions about what the department thinks about specifically that portion of the ERAP that's been funded and has specifically funded those type of positions. They seem to be something that is actually more of a missing link, for that type of support, particularly we see for people in the motels and hotels, but also to prevent homelessness, trying to do some of that earlier intervention and work with individuals and families. So I guess I'm just wondering what your thoughts are about how to fill that gap that will be created when that funding is exhausted in June.
Thank you. Yeah. So housing stability services was part of the overall emergency rental assistance program that you mentioned that started, I believe, in 2022 as part of a, COVID relief response. Vermont State Housing Authority administered the rental assistance, and as a small state, we received sufficient funding to allow us to offer this housing stability services. And I think we're one of only a handful of states that did opt to use it for services and not just the direct financial assistance. So we have supported housing navigation and housing retention services. The first year, we also, year and a half, we did significant assistance for just like application assistance to help households, go through that process. So we really saw the majority of staffing associated with emergency rental assistance in the first 2 years of this program. We do have, I think it's 18 to 20 providers still offering services through emergency rental assistance. That includes both housing navigation and housing retention services. Again, we have seen the staff associated with some of that decline. I think some folks in their earlier applications and proposals then faced some workforce challenges to fill up to the teams that they had originally proposed. But again, we do still have those in place. I think as an administration, we wanted to make sure that we had the funding to support emergency shelter expansion that we had started with one-time funds. And so that was the priority decision that we made. For programs that are eligible for HOP, we do anticipate that we may see them apply for HOP and we may have pressure there. And then I think we would, again, just have to use our decision-making process in which we look at regional allocations as we make decisions for state fiscal year 26.
And so so we do see in the governor's budget 3 point something million for essentially putting into the base things that were funded at a one time in terms of shelter expansion over the last 12 to 18 months. And the additional 2 million in one time, what I'm hearing you say is that you're prioritizing shelter expansion with that 2 million. Is that accurate?
Yes,
Yes.
that's correct.
Okay. And I'm just, I understand the need for more shelter, community-based shelters. Also understand that they're a lot more expensive to run, and they don't provide as much in the way of quantity of shelter that we currently have. And then I'm just looking to think about some of the research that we have looked at over the course of the last several weeks has really pointed to the need for that case management support for people to get anywhere near close to being successful in trying to navigate from a temporary situation to a more permanent situation. And so I think we're struggling a little bit with understanding why that's not prioritized when we know for like a large cohort of people who are getting emergency shelter that they don't actually even have access to that kind of support right now. And that seems like something that we've heard over and over again that will move the needle. You know, I don't know if you have anything more to say about that. I understand you said you needed to prioritize, and we're just questioning whether or not yet expanding shelters again is the right place to devote the limited resource investment, and whether or not the use of those funds potentially for backfilling existing services where we're losing funding might be an approach that is going to actually serve more people.
Thank you. I think the estimates that we've looked at for the base increase, those maintain the capacity that we've added this year. So I think we, you know, want to make sure that we can kind of keep our word to our providers who, when they have said, yes, we want to step up, we can do more shelter. This is one-time funds. Will there be funding next year? You know, we want to maintain that. We do have the investment of permanent supportive housing, which you might have some overlap with those who are served through the ERAP, although it's not the same intended population. But that's correct. I think, again, this is part of the crash from this COVID era funding that we've seen coming into Vermont, is that it's been very hard for the state to kind of maintain funding levels that were so, you know, that had a federal source. And so I think this is just that sort of ongoing. And so, right, at this point, that was not part of our proposal to kind of maintain those. I'm not sure if everyone is aware, but Representative McGill and if has a request for us to provide a spreadsheet that does have the staffing positions through Housing Opportunity Grant Program, Family Supportive Housing, and Emergency Rental Assistance Housing Stability Services. So you have the information about what we're funding this year, and happy to answer any questions about that.
Yes, we do have that information. We're aware that I think it was more, the question really comes down to I'm not really talking about the $3+ million for the, you know, shelters that have already been developed. I'm really just kind of talking about that $2 million in one-time funding, understanding that it's one-time funding, but also understanding that these community providers also have existing staff that they would like to hold on to that seem to be critical to meeting the current need. And so I was just asking about and you told me, I mean, you know, you selected to use that for further shelter expansion. We may or may not have a different recommendation about how that $2 million is used. So that's just sort of, I appreciate the additional information you provided, I guess is what I really want to say. Okay, other questions, folks, for the witnesses today? All right, well, I'll keep asking questions if nobody else has them. The coordinated entry process, and hold on a second, here we go. Okay, so, I think that I understand this, but I'm not sure that everybody on the committee does. So can you describe how continuum of care, coordinated entry, and HMIS all are part of this sort of same blob of existence out in the world there. Can you describe how you put them in your structure and process from your first slide? And, at once I thought of like, okay, I think I really have this down. And then every time then somebody starts talking about it in a different way, then I feel like I get confused again. So can you do your best to try to help us understand the relationships between these things?
Yes, I will try. So I think I'll start with continuum of care first as sort of a structural designation. So nationally, we work with HUD, Housing and Urban Development. They work with communities with this continuum of care designation. So it's not that they're working with 50 states, they're working with several more of these continuum of care. And so you often see them in like metropolitan areas or larger counties, and then they often sort of have like a balance of state for some of the more rural communities. So in Vermont, we have Chittenden, and then we have the balance of state. So those are sort of like organizing bodies. They help to really offer structure for training, technical assistance. It's how we apply for HUD funding. So competitively, when we apply for HUD funding, we do it by continuum of care. And the allocations that we sometimes get are by continuum of care. So it's really sort of an organizing mechanism that HUD uses in which we operate. So then if HMIS stands for Homeless Management Information System, which is what we use for data collection for all of the OEO funded as well as continuum of care funded systems. And the continuum of care sort of chooses an entity to administer the homeless management information system. So in Vermont, we work with Institute for Community Alliances. And that's true in both the balance of state and Chittenden, and we have a unified homeless management information system. So that's really
does the department use that system? Is this where the disconnect comes in? Does the department utilize that system in terms of any input that it has on folks?
My understanding right now is that I believe Reach Up is using it in a few pilot communities. And then we plan to use it as part of the administration of our permanent supportive housing assistance Medicaid benefit.
And so, and this may be a totally not accurate kind of question, but so people who apply for temporary emergency housing, how is that application and approval process documented? Where is that put?
I can take this one, Lily. That is through our system here in Economic Services that we built a year ago, July. So prior to that, it was all in our access system, except for there wasn't really a database there. And so it was mostly Excel spreadsheets. So now we have a new, I can't tell you what the kind of system it is, but we built the system essentially so that we had the ability to pull information, because a lot of information was requested of us that we weren't able to really drill down into.
And so how do these two systems interact?
So there isn't a lot. I think we continue to explore if there are ways to be able to do data merging from one system into the other. We haven't. I think I can't remember when I was there. We had explored it. I think it's over $1 million. Is what ICA had quoted us to be able to do something like that. When we do engage with it, we just did the pit count. It's like maybe a month ago now. A little bit more. And so that is like, we had temp staff who were entering stuff into HMIS to be able to do that. One of the limitations is for our inability to be able to get information out and not to be able to carve out. So if you want to know, which everyone wants to know exactly who we're housing through the GA program right now, we aren't able to do that through HMIS as it is covering everyone that is experiencing homelessness. So there just have been some challenges. And just I believe we are still trying to enter into a pilot for some of our reach up teams. That has been a little bit of a challenge as well.
So that's obviously something that's come up during testimony as feeling like a resource drain for some people. So that helps me to understand. I'm not sure. I'm just trying to figure out why the resources were all spent on developing, the database that you move from Access into this new database or spreadsheets into this new database. Why that amount of resources wasn't just spent trying to figure out how to modify, or if that's possible, how to modify the HMIS to produce what it is that you needed. Excuse me.
Oh, yes. I believe that had been explored, and continues to be explored. And part of the problem was we needed to be able to have information at a ready to try to create some efficiencies for folks, which we have been able to do, through the application as well. So we took it upon ourselves. Yes, longer term, even we have our own the integrated eligibility system that we are going to be moving towards, and that would be something that GA would go into. But time was up eventually.
Okay.
So in terms of the flow, Economic Services does refer households who have been enrolled in general assistance emergency housing to the local coordinated entry lead agency within 3 days. And then they conduct outreach to complete the coordinated entry assessment. The coordinated entry assessment is just one of many projects that utilizes the homeless management information system. So that is what the assessment is used to then create the master list. But then, there are shelter projects and there are other projects that have, that are operating using that as a tech solution. So again, it's more than just the coordinated entry assessment, but we do have that referral process. And then, I just lost my train of thought. But so that is a way, though, that ESD is working with the coordinated entry lead agencies to make sure that households are being referred for the assessment.
Other questions for Miranda and Lily? No? Last chance.
Yeah.
For today.
Yes.
Yeah, go ahead.
Can you, sorry, I think I've asked this before and I don't remember the answer, but as it relates to family supportive housing and this new supportive housing program, so I saw that you've expanded family supportive housing recently and has the ability to serve a lot more families. So I'm assuming, just correct me if I'm right or wrong, that families that are in the GA housing and the hotels and motels are being referred to family supportive housing where there is capacity.
Yeah, thank you so much for the question. This is a great example of how we try to leverage coordinated entry assessment so that if you are, for instance, a family services worker working with a family experiencing homelessness, you don't have to think about like, oh, is this family eligible for family supportive housing? Are they eligible for permanent supportive housing? All you need to do to say to the family is like, let's just make sure you have the coordinated entry assessment done, and then that will do that screening. And so for community providers, the coordinated entry assessment just allows them to kind of funnel people to one assessment, and then that's what we use to prioritize referrals to family supportive housing. So if a local family supportive housing provider has an opening, they would reach out to their coordinated entry lead agency and say, hey, can you send me the next name at the top of the list? And the homeless management information system is used to take the information provided in the assessment to prioritize families per the eligibility of family supportive housing so that they can say, yep, Lily's top of the list. And then the provider can go ahead and do that outreach and see if the household wants to participate, make sure they're eligible, because maybe something has changed, since they went through the assessment. And that's what we're planning to do with permanent supportive housing assistance benefit as well, is leverage coordinated entry. So again, as long as folks are going through that one door, that's a way that they can get access to various services.
Can I ask a follow-up to that?
Yeah.
So, can I,
Please share.
I'm trying to, so, and maybe this is how you answered the question, and I was distracted for a moment. So are people who are in the hotels now going through coordinated entry and receiving an assessment?
They are being referred, and lead agencies are following up and scheduling the assessment. And then I guess I can let Miranda or Deputy Commissioner Gray talk about if there are, I think this goes to then some of the case management requirements around general assistance emergency housing, maybe is where you're going with that question.
Is that where you're going with this question? Would you like me to continue?
Well, yeah, I mean, I'm trying to understand. So, I think everybody has the understanding that most of, I guess all the housing agencies using coordinated entry as a method of referral. And if people, and I know we had this conversation last year, if people in the GA hotel motel benefit are not getting into the coordinated entry system, then they are losing access to referrals for that kind of housing. So yes, I guess the answer is yes. I mean, to what extent are people actually, like, who makes that referral? Who makes that referral? Does the eligibility specialist at DCF make the referral? Do they follow up to see if the assessment's been done? What's that process?
Yeah, so the answer is yes to both. So we do give that as kind of like an assignment. This is something you have to do. We need to do that for the law that was passed. You have to be engaging to try to resolve your homelessness. So we make that referral. We've set up systems, and I don't know if we found the perfect one, but we have to get confirmation from that lead agency that someone has engaged, or if they haven't engaged, because if you haven't engaged, then that you wouldn't be eligible to have your housing renewed unless there was a good reason. But to your other point, I think what you are getting to is, for some lead agencies, there's a wait time. It really ranges. Some, it might just be a couple of days, and for others, it could be longer. And then getting attached to a case manager could also take longer. And I think that, just speaks to the fact that I think we have a bottleneck because we don't have units on the other end to be able to move people into as apartments.
So, yeah. So that just created a bunch of little, if you were in the room, you'd be able to see it better. I actually understand. We all know that we don't have sufficient units. Okay. So I get a little frustrated with that kind of coming up as a reason for everything in the world. No, it's true. I'm not saying that it's not true. And it's true that that's what prevents people from moving out of homelessness to being housed. I don't think that's what's preventing people from getting timely access to coordinated entry, however, which is a whole separate, discussion. And what I'm hearing is, I'm not hearing that the department actually knows what percent of the people who've been referred. So there's 1,400 households in the hotels right now. How many of them have actually been referred, assessed, and are in coordinated entry?
100% would be referred. And I would have to because we are getting information back, I would have to go and ask, do we know? But this is another one of those limitations of do we have a tracker? Or is it something that we have to do manually to see yes, in fact, they engaged, or no, they didn't engage. And then there is a lot of back and forth, because essentially if someone doesn't engage, we tell them they're not eligible, then someone will want to go and engage, right? And so there is, or feel I need to engage. But how long it's taking to be able to be connected, to really be assessed, I think it comes down to as well, and I'm sure you've heard it, and I know that I've heard it, it's workforce. right? Like if you don't have enough people to meet this demand, that is another pressure that our lead agencies and others are feeling. And I'm not sure.
Okay. And this probably maybe isn't a fair question to ask you folks because you don't run the coordinated entry lead agencies, but it doesn't seem like there's anything preventing somebody from a coordinated entry to actually set up shop at a hotel and have appointments right there, as opposed to, maybe expecting. I kept hearing say they didn't engage. If you're just trying to figure out where your next meal is going to come from and if you're going to have a place to sleep, you're not thinking about engaging with coordinated entry. But I'm just wondering if that's one of the practices that people use. And if you don't have the answer to that question, I understand, because I realize you're not the folks actually running that.
Sure. So a few things. We do an annual evaluation of the coordinated entry process. And so the vast majority of people are being assessed within 7 days. I think we do tend to see longer waiting times than for the services that come after. So the just general housing case management services. So the data that we're seeing looks fairly good in terms of people once referred being assessed within 7 days. Over the past few years, I think we've seen a variety of on-site engagement at motels. Sometimes it comes down to motel capacity. Like some motels do not want staff on site. Some are more than happy and will provide, confidential rooms for people to meet. So sometimes it's a facility-based issue. Again, you have the kind of spreadsheet of workforce that you can look at. And so, as people are kind of managing their staff and making efficient use of their staff time, again, that's where you tend to see this tension of like in the office, they can often see more people than if they go and are driving around, they're reaching people, but then they're going to see fewer because it's taking up more time. So I think you can look at that data to see sort of the capacity in each community and how it is a challenge that I think our providers are balancing of wanting to make the decisions to make sure they can see as many people as possible, and how does location play into that factor into that.
Okay, we have a question from Representative Bishop, and then I'm going to give you a prequel to a question. I'm actually going to ask the question, but I'm going to give you a chance to think about the answer. What is going to happen with the 17 families who are housed in the family shelters that is supposed to end at the end of this month? But in the meantime, Representative Bishop.
You just referenced that some motels don't want your staff on site. I guess I'm kind of surprised at that. Is there any opportunity that can be a required part of the arrangement if the state is putting the bill for people staying there?
So those are conversations that I'll say, when I know about it, then I can address it, but I don't always know where those barriers are. Where it has been highlighted for me, then we do have that conversation. And sometimes, to Lily's point, there isn't a private space. Going into someone's personal room isn't an option. So it's like, what else can we arrange that might work for both entities? But yeah, it is something, if there is adequate space, and we do have examples. I have visited hotels where a space has been made, community partner can go and engage with people there.
Okay, now about the families.
We are working on plans, and I don't want to get ahead of necessarily just some contracting and procurement processes, but we have plans that hopefully will provide extensions in both spaces, and hope to be able to kind of finalize award notices, in the next 2 weeks, that I think we can then report back on more details of those timelines, and exactly what those plans are. Again, there's a lot of important stakeholders and financial procurement pieces, so don't want to get too ahead of that process, but it is something that we are working on, while also just working with each of those households on their individual plans, as we have been since November.
Okay, all right. Well, it brings up a whole bunch more questions, but, sorry, go ahead, Representative Bishop.
If my understanding is correct about who or how some of those shelters are being run, are those the ones with out-of-state entities who are operating them?
Yeah.
And would we be continuing, if we get the space contracts squared away, would we be continuing with the out-of-state contractors?
I heard the word extension used, so that sort of indicates that, but I don't know that.
I know, I feel like I'm like 2 weeks behind on this or like 2 weeks ahead of where I want to be on this question. Not necessarily. I think, we are grateful to have the contractor step in and work with us. They have been a very supportive and responsive partner as the state has operated those shelters. I think, as we said from the beginning, we really value our community-based providers. We've worked continuously to try to see if we have options in the community to take over operations of those spaces. I feel hopeful that that we can get there. And again, I think it's some of the timeline issues. And then again, just wanting to be mindful of like some of the key stakeholders that we need to be communicating with. Again, I feel like in 2 weeks, I'll have a really, really great answer for you with all the details in the world.
Okay, well, we'll hold you to that, I
Yeah,
guess.
we'll hold you
And I guess, I know you just got a couple of minutes before you have to leave. Have you fully expended or have plans to fully expend the $10 million that was one-time dollars for essentially shelter expansion? The money that was supposed to be used for people who didn't qualify was supposed to be used for the emergency sort of pop-up kind of shelter. And I recognize you got a lot of proposals and you've selected some, and where are you in the implementation of that $10 million, and will that be expended by June 30th?
All of the money has been obligated and was obligated by at some point in the fall. We have had some changes in projects and have worked to find other ways to move forward. I'm not sure if all of it will be spent. I don't believe all of it will be spent by June 30th, but we have made commitments with those funds.
Okay, so they are obligated. Do you have grant agreements or whatever for the whole $10 million, or do you have some that's still in process?
We have grant agreements for the full amount. And we may have to, I think we've actually probably over obligated as we've made changes. I'm trying to think if we'll have to issue new ones as well to account for some of the more recent changes.
Okay. Okay, thank you. I just, as we're looking at things, we're trying to also be mindful of things that have not been utilized that were already appropriated as we look to our 26 recommendations. So that's where we, things overlap. So I just want to say thank you for being here this afternoon. Thank you for your continued work on this. And it won't be the last time we talk. So thanks again, and we'll talk soon.
Thank you for
Thank
having
you.
us.
Thank you. Bye-bye.
Bye-bye.
Thank you.
Okay, folks, we have a change in our agenda. So we are not going to hear H238 this afternoon. They are still working on that downstairs in environment. And we are also not going to have discussion about H91 this afternoon. We're going to continue our budget work before floor. And if we need to continue it after floor, after H2, which is supposed to be relatively short, then we will continue after that time as well. Okay. So just so people know what we're doing. And we're on to DCF. still in DCF.
Which piece?
I know, I don't know. I'll go to my right now.
Quick and easy.
Well, I don't know if it's quick and easy, but let's go with you. Let's leave the childcare people waiting out there longer.
Okay.
Kidding. They know I'm kidding.
So we actually, if I did send an updated chart line, and I know you want to hold off on language, and
Yeah.
more of what we have to say is probably captured in language. And our little chart doesn't actually have section numbers except for one of them, because they mostly were not sections in the governor's recommended budget. There were only two things of particular note in the budget, and we did not disagree on the face of it with either of them. One is the need, as we heard in BAA, for the transportation contracts, the challenges around that, and the other being the increase, the rate increase for the EMNIs. And we weren't objecting to either of those. There was a question about transportation that I've referenced before. If they're getting squeezed on options for transportation, are we going to see, going back to over-reliance on sheriff's transport and inappropriate use of restraints? And they are working on getting us that updated data. They haven't found it right away. Maybe we do need to maintain reports when time goes by. But we had talked about adding language, and it seems like until we know that, maybe we don't want to put it in at this point. And the Judiciary Committee has assured me that they would be happy to add that into their miscellaneous judiciary bill. So there isn't an urgency to try to resolve that before we have the data. However, the most urgent priority is, in fact, the supervised visitation programs and the loss of, $30,640 for coordination of those sites around the state. We were able to identify an amount of money to cover that for a year from tobacco settlement funds. And so what we're recommending is that that backfill be placed there for just this 1 year, because it really, looking at it, exposed some broader problems around it not being available in 5 counties in the state, despite the fact that courts order that you can only have visitation if it's supervised visitation, and some lack of clarity over DCF's contribution to the funding of the programs and the court involvement. And so we have language that when we get to it, you'll see that asks for a report back next year from the courts and DCF saying, how do we sustain funding in a more rational manner? I mentioned the PNMI built-in inflation adjuster that none of the community-based organizations, and I think under DCF, many of these direct service grants may not come under the definition of home and community-based services, but it's the same issue. They're expected to do this the same, but not get that money. So we have language to suggest just that for all of community-based direct service grants, that we simply get the information each year from the involved departments under our jurisdiction of what per 1% the increase would be, so that we have that working base and not have to ask for discrete, subgroups. The one last discrete area is the area around Mentor Vermont. I know everybody's been getting a lot of emails about the
Not me. Sometimes people don't realize that there is such thing as overdoing it.
Yeah.
Yeah.
Somebody got the word out,
That's where we're
email
at.
the
I'm
committee.
measuring right now. I'm just letting you know, overdoing it is It's not good.
And I think in some ways, it's hard to understate the value of this kind of program. I think all the evidence has been really clear for some time. We see reporting evidence all the time that having connection to one as adult that you can trust, that you can turn to for support, can make a radical difference in terms of everything from future substance use involvement, delinquency, mental health issues, all of those things, it can make a really critical difference. This, for us, was a very difficult, the request was to significantly increase again their funding, their state funding, as we did recently, in order for them to extend their reach. And there's always a problem when we have, as we're just talking about, discrete groups with really well articulated and valid needs. But there are a lot of people doing good work in the community who might not have the same knowledge of what routes to go to try to get additional funding. So part of, I guess, maybe we should have been thinking purely on a case by case. If we're saying, is this worth investing lots more money in? Probably the answer would have been yes, but it's got to be balanced out with a lot of other needs. Our recommendation on the chart, their request was for basically doubling their base grant. That was their starting point anyway, which it had been for many years, 170,000 a year. It was increased last year to 650,000 on recommendation of this committee. They did really expand the work and start rebuilding post-COVID. Our recommendation is to increase that with another 100,000 to further that work. But I also, as we went through the statute on the opioid settlement funds and looked at some of the other, also very excellent initiatives on prevention side and how much we often miss some of the key prevention work, it did occur to me that as we go through the opioid bill, that we might want to look to adding some funding from that source as part of that prevention work, as a way to further expand that work. The last piece, yep.
Yes.
Just a clarifying question. The governor's budget includes an additional 100,000 this year?
No,
Okay.
the governor's budget has no increase.
Oh, the column there says,
Oh, I'm using the wrong column. That's right. What I meant was that's what we were, I put the wrong column, sorry.
Okay.
Governors recommend that's the wrong, right, just like
So
with the
can I
tobacco fund.
clarify?
I've got this wrong, because the need of the transfer under the first line, that's not the governor's recommendation, I'm sorry, I goofed up this chart. I'll have to redo it.
No problem.
Yep.
Is the 2.34 million, is that?
That
the
is the
budget?
governor's budget.
Okay. And does that have a B number?
I couldn't find those numbers on the chart we were using, but I don't know that it ends up in the
Okay.
final chart, because we're saying,
Okay.
we understand it. The question there is about the transportation sort of side issue. And likewise, Mentor Vermont, which had no increase and therefore didn't show up as a budget line. So there's no line number
Yeah.
because it wasn't listed there. So the biggest category that we were trying to grapple with, and DCF was very helpful in getting the information we were looking for that doesn't exist on the budget charts, because again, budget charts only say ups and downs. And if you looked at the section on secure residential treatment facilities, which is B327, there's basically just very tiny little adjustments or no changes. And yet we know they've opened Red Clover, they've done all these other things there. And so what it turns out, what we learned through kind of getting the background, is that there's no increases because they have had enough money, carryover money sitting there, or one-time appropriation sitting there, so that they have the money for some significantly expanded programs that they've been working on. So if you look at last year, fiscal year 24, so 2 years ago, what was 3.3 million in programming in that category is now 9.6 million. That's a big increase that you don't see at all in the budget lines because it's all reflected in carryover money being used. And actually, if all of their expense categories, some of which they said were, they're a little uncertain at this point, but if they all are fulfilled, they actually are presenting a budget that is 1.7 million deficit. Which would mean if they ended up needing all of that, they'd have to be looking for that in budget adjustment. So starting from a deficit point, the biggest part of the facility program increase is the expectation that they're going to be opening an additional 2 beds, staff secure beds in Wyndham, which is a project people who've been here have heard for several years in a row that that's imminent. It's still imminent, but it still needs about another $1 million worth of construction that hasn't happened yet. But both Wyndham and the Red Clover 4-bed facility basically cost a little bit about or slightly more than $1 million per year per bed, which is a lot of money. And so
that daily amount.
yes, the daily amount, I had done the quick math. What was it? $2,800 a day.
Per bed.
Per bed. Assuming the beds are all occupied. I mean, that's actually an overall cost. So if there isn't a child there, you're still paying for staffing. And that, I mean, I think it just underscores the concern we've had in this committee and said before that when you end up with focus on the high end because it's seen as most urgent, that's a huge drain on resources that isn't going into, lower levels prevention or even just group home support. The budget line for what's called the SEAL program, which was referenced in prior years, which is 12 beds. And that program operates on, where is SEAL here? 1.2 million a year for like 12 beds. So that's a tenth of the cost.
What's the difference between the SEAL?
The SEAL program is a staff secure. It's not a locked secure program.
It's a lower
It's the next lower
level.
Right.
Do you know what utilization of that is?
Well, they actually
kind of their average occupancy, or could it be utilized?
Well, they actually have 16 beds. They're currently using 11, so it's using a base, but that's based on the acuity and intensity right now. So it's not as if they're like they don't have kids they could use. But it raises another question because one of the items we were looking at is the staff secure, or I'm sorry, the youth staffing contracts, which is at a little over $1 million. And it was sort of like, what, isn't that the one-to-one staff that have to stay with kids? And are we able to reduce that if Red Clover and then Wyndham are open? And actually, that's not what that is. That is actually their contracted one-to-one staff with TLC, which they had presented to us previously. That was supplementing and to some degree replacing, but supplementing the DCF staff one-on-ones. And they can't really easily pull out of the budget what savings there might be in terms of fewer one-on-one staff use. And they do still need the TLC one-on-one despite the two, the capacity isn't enough for all of the need at this point. Plus it's a 2-year contract, so it's sort of locked into the second year for it. Regardless, they might be able to go down the next year. But clearly it's a whole lot of money for the high-end care, and actually the Judiciary Committee wants to put some language in their budget expressing a concern about that, and which I certainly encouraged and think, we probably want to share that message. There's one tiny piece of language that'll come because we had a stakeholder group to be engaged in the discussion of what the replacement secure facility might look like, and it actually sunsets this June, so extend that. So I think that's about it. I still need to double check with the Chair Emmons downstairs about whether the construction and startup costs, whether that actually belongs as a capital bill. At what level of cost does it belong in the capital bill rather than in the operating budget? But other
So
than
is
that,
the budget here, is that just operating or does that include for the?
so when I said the 9.6
Yeah.
million is operating only, their budget also has 1.5 million for construction and startup. Some of that they're kind of having on hand for planning for the Fort Youth campus. But probably about $1 million of it is for the actual construction that's still being contracted out or whatever for the Wyndham 2-bed program. But so that's separate from the 9 point, what did I just say?
9.6.
9.6, right? So we don't have any financial budget recommendations to make on this. It's not as if there's a proposal out there that could be funded to create an additional lower threshold capacity, but it's not a good scenario because this is going to escalate significantly in the years ahead, which again, then detracts from the ability to support kids at an earlier phase. So.
Thank you. Are there questions for Ian and Brenda? So we have CDD and ESD and OEL, right? So you guys. I think. Yeah, I'm thinking, let's take a 5-minute break because I think Teresa will need to be here for both of those conversations.